Okay, so I think now it's the we already talked about Swiss app. We talked about Immuni in Italy and also a French Corona app. Now is the time that we go for German Corona app, which is called German Corona Warn app. And here I would like to connect to what Stefano said. I think that talk was extremely interesting because he provided the lessons learned, and I can really feel it because these are the lessons that we learned as well. And the reason for that is that a number of academia were doing research in this area, first of all, independent from each other. And in our case, we started, or at least my group and myself started when I came back from China in 2019, December 2019, as I heard in China that there is something going on there. And then I have good connections to Chinese colleagues, and we started to think about what is happening in Wuhan. And when I contacted my colleagues in Wuhan, they could tell me, yes, there is here something going on with the virus. We don't know completely what it is. Nobody knows about it. And then, of course, it was January 2020, and then in February, and then we got more news from China and other places. So we got interested as a social responsibility to look into it from the technological part, first because we wanted to help. And then we learned a lot of lessons that Stefano mentioned in his talk, so I'm not going to talk about that because there were very similar lessons that we learned. So I started to talk to many people worldwide, and with my team, we really put an immense amount of time because we asked ourselves, can we make an application that uses digital technology to against the pandemic? And it was, I'm not saying that I regret that. We learned a lot of things. We came up with our own design. We came up with 4,000 people tested it. Also at university, we wanted to apply it. But we saw where are the real problems, not only the aspect, because our challenge was more academic challenge. Can we do it? Can we make this app what Chinese were doing with completely transparency? So really, every information from every user, they knew exactly what the user does because they pay with Alibaba, Alipay, and Alipay has all the information about the user. So that was our question. And we think we solved it from the theoretical point of view, but in practice, things look completely different. So when I talk about German Corona Warn app, this is because we had our own development already in May 2020, and German Corona app came out much later. And as Stefano said, that doesn't mean that there is incompetencies. It means that many governments, they were just pushing for this app as a placebo. That one we understood later. So when I talk about German Corona, I don't want to discredit any engineers or any people who worked in this area. I'm just like many other colleagues before me, we want to point out the problems and the threads. And I do not believe, I mean, Stefano is I think, very nice guy, but in my life, I would never trust these big corporations because nobody, in all policies that Facebook had, it was not written that you can, give all our private information or water information, I don't know, to analysts like Cambridge Analytica. This is their business. So let me just start with what we have learned. So first of all, a view of the world, as I showed that this slide at the beginning. So we discussed about centralized and decentralized. Actually, this is not a problem anymore. These are some examples of countries who started with centralized approaches, like mainly in Asia. And then other countries started with decentralized approaches. And then among all these things, we came up with our German Corona Warn app that was actually had a goal to, this is a decentralized app, to efficiently and quickly detect and interrupt the infection chains. the technology, as for Swiss app, was based on, or as for many other apps, was based on Google and Apple exposure notification. The number of downloads is now more than, this is a number that is now more than 20 millions, but this is only the downloads. It doesn't say anything about if people are really using it. The costs for this app, and that's the nice thing, an interesting thing from a corporate greed point of view, it's 68 million euros by the end of 2021. And 20 million euro was used for only the app development. That means the wrapper over the API, so to say, around the API of Google and Apple. And as Stefano said, maybe in US, people don't trust the government, people don't trust the corporates because of privacy aspects. But here, interestingly, in Germany, it seems that many people follow what government said because government, they trust it because of public health system. And that is the subtle problem that people don't see. This is not a location of a restaurant I'm looking for. This is a public health system. And of course, they didn't tell to people in a clear way. By the way, disclaimer, this is not what TU Darmstadt says, this is what I say. They didn't tell to people on which technology this app is based on. They just said two big German companies are going to make this app, which is true, but just as a wrapper over the main core technology coming from Google and Apple. This is the easy way to look at. And we are going to discuss that in the panel. So we had this Google and Apple exposure. You heard about it a lot of times. And you heard also about attacks, and I'm going to talk about the attacks in a practical way point of view. But then we go beyond that because this is not important anymore. Yeah, the very important question is, do we need that? Yeah. So there were a number of security and privacy attacks. Excuse me. Please.
Sorry, I have to find her. Then I can unmute her.
Yeah. So.
Okay.
The security and privacy of Google and Apple, in many papers, they have been considered, they have been criticized for their ignorance because they ignore these works. This is a known fact. And so we start with some of our colleagues very recently, and this is going to be published very soon. I think even tonight or this week, you can access this. We are together with a number of colleagues. Some of them are giving talks here. We just pointed out that points that all those aspects that we think are really a threat to, it's a Pandora box, and we should not forget that. This is something that has to do with public health, and it has also kind of with European sovereignty. We will come to that as well. And let me give you some a flavor of real world attacks. So until now, we said these attacks are known. So relay attack, what you have heard many times during this day, is something that is known from 80s. This is an attack that you cannot simply prevent unless you use, for example, in case of tracing the GPS data. But if you even mention GPS, many people, start to look at you like, I'm not going to give my location for a public health app. So let me give you, so this is a work that we have done with our colleagues from University of Marburg. It took some time to do that. We just joined the forces. And there are two main attacks that have been mentioned here. One is wormhole attack and the other one is tracing attack. So privacy, security and privacy attack. Wormhole attack is the relay attack. And what does it mean? We had from Marburg, these are cities in Germany. And also we worked together with our colleague, Alexander Dimitrienko from University of Würzburg. So we had these cities and we started to think about, okay, there is a distance between them. Can we generate, so to say, false contacts, false encounters between these cities? And this is indeed very easy to do. The first first approach was using mobile phone sniffers. So you just collect all these random data are sent as a beacon over the Bluetooth channel. And these, the so-called RPIs in the Google and Apple design, you just send this over in real time over a message sending server to other phones that are just spreading these RPIs further. So if there is an infected person there in between these RPIs or these daily keys, then you can see this person at different places. That was the way we do it. So we really did that in a, so to say, in real world. First, we did it with Marburg and Würzburg, and then I show you what we have done very recently. And the other one is was tracing attack. That was also mentioned by Serge in his talk, that you can indeed track, so to say, or at least make a movement profile of an infected person. And for that, for this movement profile, we use two things. First of all, you can use it with a mobile app. And if there are measures by Google and Apple to find mobile apps that are using the, so to say, the same beacon sniffing of beacons of over Bluetooth channel, because you can put a malicious app, as it was mentioned before, by Joel, for example, into the App Store, and people can download it. And these apps are some kind of game apps. People don't know that they are collecting. Actually, they are sniffing on Bluetooth beacons. But we have also used here this beautiful
I'm back again. Yes, you're back again.
Yeah, I'm back again. Okay, that's fine. That's fine. Okay, I hope my picture as well. Okay, so we also used a simple device, Raspberry Pi, and you can and how we did that. It's relatively simple to do that. Just a second, I have to come to. We brought this device or our sniffer app at really strategically chosen places and locations like residential areas, city hall, police stations, clinic and pharmacy, or even pubs. And we could collect a very interesting, so to say, number of these beacons. And then people have routines. People come to a railway station, people go to job, to their work, and they come back and go home. So, and then you can really see that these infected people, how they move and how they, so to say, how their movement graph is. And then, of course, if you think about Google and Apple opportunities and possibilities, how they can connect, so to say, how they can make a social graph, as was Joel saying in his talk, you can have access to much more data and make a social graph from these infected people and even de-anonymize it. These are not theoretical. Exactly this argument was used against centralized systems by people who wrote the paper on the DP3T, which is a decentralized solution coming from Switzerland. So now what we did very recently is that now Immuni app and Corona Warn app in Germany are connected because they are using the same API by Google and Apple. And of course, Immuni is not so popular as popular from the number of downloads, but again, we don't know really what people are using it or not. And we could indeed run the relay attack from German app to the Italian app. So that means we could, again, generate wrong encounters in two different geographically different places. So how effective is the German Warn app? So these numbers that I'm just mentioning to you are coming from a GitHub. There is a person who takes all these statistics. It is not something that you can say, oh, it is exact. It is numbers that somebody does voluntarily, or somebody is paying this person, they are doing it. So let's say by November 28th, we had maybe estimated number of people who shared their diagnosis key through the app, were something around 90 3,000. And this would be kind of 10% of persons tested positive after some calculation from this statistic. So these numbers is not absolute. So these are numbers that you cannot fully trust, but this is what we have. So, and then there is no information on, as Nuria said in her talk, there is indeed no information on how many tests were triggered by this app. There is no information on how many of these were actually positive, what was the effectiveness. And the reason for that is this is the lecture that was a lesson that we learned. We were lectured by the reality so that you don't have a feedback possibility. A feedback possibility means that if you really want to do it privacy preserving, you may need a hybrid system. If you really want to use technology to at least help a bit, you need a feedback from the app to that server that is collecting all this data and pushing it to the apps, so that this feedback clarifies all this information that people need as epidemiologists or as other, so to say, like survey researchers, that they need this information, or health experts. So you need a platform. So there are also other problems which are more, it doesn't have to do always with the design of the Google and app, but Google and Apple system, but it has to do with the development of this system. Like the app does not notify in the background for many users. The majority of users, they are not happy with usability aspects, but you're not going to take a bad system and make it even, trying to make it usable by pushing more money into it. So some infected users cannot share their temporary exposure keys, location setting needed to be enabled, and we will talk about that in the panel. So I compare this to, maybe many of you know this picture. This is what I show also to my students. So how is this app sold to us by politicians and by immense amount of money for advertisement? So at here you see that, for example, let me show you. This is the picture. Sorry, this is the picture that I was talking about. So here you see how the customer has explained the design, what the design we really needed, and then you see the project manager, how the project manager understood, and at the end you see how it was built, like this one, and then what we really actually needed was the last picture on the right low corner. So this is what this app has is for me. It's a typical software development with huge amount of money. So there are of course other decentralized apps from us. From PACT was mentioned by Stefano, both for MIT and in Washington. Also from EPFL and ETH, there is another. So the second, so to say, version of DPT3T, or Pronto from University of Salerno. These are decentralized apps, but the question is, are these apps going to do the work that we want? This is the question, the most important question. And what else do we need? And I call that, at least what happened in Germany, I call it disaster capitalism. It is a government industrial complex. It has disproportionate cost. It suppresses innovation. It threatens indeed the sovereignty. And of course, it has security and privacy problems, and the lack of evaluation of effectiveness. How do we evaluate that? So what is actually needed? I think we need a European solution. We need a privacy preserving, if we really want to have privacy preserving infrastructure that allows a feedback. And then we need a framework that uses or chooses the most effective solution. It could be also a centralized solution. And we did not discuss that. We just try to kill it from the beginning. So I'm finished with my talk, and I would be happy to take questions before we go to the panel. So no questions?
Any questions?
No questions?
Just, yes, Alexei Greenbaum.
Yes, thank you. Thank you very much for this review. I very much agree with most points you raised. Just a bit surprised by the last slide about solutions. I think today we can also envision a possibility of not having a Bluetooth low energy solution at all. I mean, Bluetooth low energy doesn't look like a solution. So with all the sovereignty problem, I would actually not talk about the availability of Bluetooth solutions at all. So I'm just surprised by all the arguments you presented, all the critique you presented. You're still talking about a solution.
No, I just said when you really need when you need to deploy digital technology, if we believe that this is the right way. I think in many countries, especially in Germany, there was only a discussion about, is that a privacy preserving scheme or not? We did not have much discussion, at least among academia. Do we need it or not? Do we need this technology or not?
Yes, also in France, the same in France, yes.
Yeah, so if we decide to take a technology, like for example, France did with their own, so to say, app. So they decided to do that. That is okay. But then you need to do everything in a transparent way, as Claude was saying, to guarantee that you can help with this app. So if I say a privacy preserving infrastructure, I mean the lessons that we learned. For example, when you get an alarm on your phone, what do? You get into panic and say, okay, maybe I am sick, maybe I'm not, depending on if you are a single person or if you're not a single person, if you have a family, if you in which country you live, if you are poor or if you are rich. So you go and you want to have an anonymous channel. Many people we talk to, they were embarrassed to say to their neighbors that they are sick. So they didn't want to say that. They didn't want to disclose that. So you first want to have an anonymous channel to a health expert. Is that possible currently? No, you call someone and they ask you about your names. Or when I had myself the experience, I called the emergency number in Germany. They said, go to your house doctor. And I went to my general physician and they said, no, you cannot come in. Maybe you have, maybe you are sick.
Ahmad,
yeah,
sir, I'm just saying in March, we had all these points raised already. People were saying in March, Bluetooth is not reliable for measuring distances. Having a manual step of entering codes will be a problem. We've heard these things in March. Why did they still push for this kind of solution? I mean, why did scientists not stand up and say, technologically, this is not a solution?
It was not about Bluetooth. I didn't talk about Bluetooth. I said Bluetooth is a popular technology that was misused for that, and we knew that it is not exact for this kind of things. But I don't know if I answered your question. I'm not pushing for Bluetooth. I'm pushing for, if you need a digital technology, then we need another discussion. The thing that we have now, we know by now, this is not something that we thought about at the beginning, especially the Google and Apple involvement in the whole process, and I don't trust them. But in general, yes, we may use technology, but it may not be based on Bluetooth, of course. So is there any other question? I think Claude wanted to say something.
Yes, can you hear me? Yeah.
Yes.
Yeah, it's more like a remark than a question. When you said that Germany, they deployed their system in May or June, and you already had
July,
your
I think.
Yeah, in July, and you already had your system developed. I mean, what you didn't say is that Germany was about to deploy their system end of March, beginning of April, the centralized scheme, the scheme they worked with us, I mean, they developed with us. And they were the first, actually. They did a lot of experiment. They were about to release it. And then you know what happened, this letter.
Yes, it was the centralized system.
So we cannot blame, I guess, the German government for being late. We can we could blame other people, but it's a political decision that was made at this point to postpone it and to go for another development.
Yes, but German government at the beginning, they wanted a centralized system, and then there was a huge debate about it. And as you said, they went to the decentralized system. But this change was not completely transparent. Yes, they did open source. Yes, they did all this. This is all good. But nobody was saying exactly that this is based on Google and Apple technology. It was written that these are two German companies who are doing that. And this is my concern. This is my problem. So this transparency was not it's not about being late. Yeah, they did a good job in developing the app and rolling it out. I'm convinced of that SAP and German Telecom, they did a good job in that sense. But I'm not talking about that actually. Okay,